everyone. It is Tuesday. Hey, how are you? Thanks for tuning in. It is Tuesday. It's 9 o'clock. And we are on Talk About It Tuesday. Hey, baby, how you doing? Carmen says, who? I can't see your real name from there. I have to look on it when you get off live. Oh, how's everybody doing tonight as we let people just kind of get on? It's Tuesday at 9. We're here in the building. Hey, baby, how are you? Hey, Brittany, how you doing? What is going on? Corona is everywhere, of course, unfortunately. So, hey, Danielle on Facebook. How you been, girl? It's been like, for real, 35 years. Way too far, way too far. Hey, Kim. How's everybody doing tonight? This lovely Tuesday night, day 2 of no school for kids and isolation and corona everywhere. How you guys doing tonight? How's everybody holding up? Dealing with everything? Trying not to listen to the news too much. Hey, Kim. So, we are getting on and logging in, and we're super excited for tonight. So, listen. Hey, Brother Gaines, how you doing? Good to see you on Facebook. So tonight, everyone, you guys, we're just going to give us a little bit of talk about what we know about corona. I'm not a epidemiologist by any means or infectious disease doctor, but there's so much crazy out here in the media, and it has us all a little bit freaked out, I think. I don't know about you guys, what part of the countries you're in, but the stores are bananas. They're ravished. I've never seen people buy so much stuff, but then they still outside. I thought everybody was going to be in the house for the past few days because they bought everything up, but then they were still outside. So I kind of didn't get it. But anyway, this is this is all we've heard about. Corona is what we've heard about the past couple of weeks. People are like freaking out and all this kind of crazy stuff. And I want everyone to just take a second and breathe, and let's remember, in spite of what the media is feeding us, there's some good news. The death rates overall are 3%. So for the over 100,000 cases, there have been just under 5,000 deaths. And that's worldwide. So that means that more and more people, hey Rebecca, are recovering from this virus than are dying from it, which is an incredible thing to keep in mind. People are recovering. They are going on to live recovering well. We just got a transmission today from our hospital that kind of gave us a really good breakdown and outline of some things about the death rates, about people being, of course, older. Hey, Kendra, being older and dying. The average age is 65 of the deaths worldwide has been the average age. Of course, younger people have passed away, but typically they've been people with other types of issues. And of course, the self-isolations and the quarantines, etc., are in place so that those individuals who have no symptoms at all cannot spread it. From the data I saw today, again, I just got a transmission from our hospital, is that about 1.5% of people who have been tested positive for this virus have absolutely no symptoms at all. So there are people out there who are, I guess, considered carriers of the virus who really don't have any symptoms. And those are the people who they want to kind of stay in the house, which makes sense because, if you don't have any symptoms, you don't know you're sick. Another interesting thing I saw in that transmission today was that 41% of what they call the nosocomial infections. And what that means is that they got it from a hospital or a healthcare facility. So they were in the hospital, maybe visiting someone or seeing someone, and contracted the corona from being inside the hospital. It appears as the strain that's inside the hospital is a stronger, more deadly subtype, if you will. 41% of the people who got it from the hospital have expired. So you don't want to go to the hospital if you can help it. But that seems like it's a little bit of a stronger strain of the virus. It's a little bit tougher to fight. That being said, I always want to come on and try to empower you guys and not just be about gloom and doom, and kind of make everybody kind of say, let's keep our heads about us in this crazy kind of season. So first of all, we got to remember, guys, that life is still happening outside of Corona. Life is still happening. Things are still happening. People are still getting sick for other reasons. Strokes, heart attacks, cancer. People are still dying for other reasons. I don't think I've seen Vanessa Bryant's name on my news feed in about 2 weeks, whereas 4 weeks ago, every other post was about praying for her because she had just lost her husband, Kobe. Well, she still lost her husband. So guys, we can't get so consumed in the corona and what's going on and all that we forget that life is still happening outside of the coronavirus. Of course, we're insulated. They're telling us to stay inside, and some of us aren't listening to that. I'm not quite sure why. But again, that if you're that 1% that has no symptoms, you could definitely make someone else sick, and we don't want any of that to happen. Okay, and so what we can do as friends, hey Miss Henry, how you doing? What we can do as just a community of people to just take care of each other is make sure that we are, one, taking care of ourselves, because now is not the time for you to want to get sick. Now is not the time for your diabetes to flare up or for your blood pressure to flare up. Now is not the time for you to not be taking your own medication and getting to the hospital and having to go to the hospital because the people at the hospital are busy trying to fight the people with the corona, and you don't want to get caught up in that crossfire and get caught up in that mix because you're not taking care of yourself at home, right? To those of you who are taking chronic medications, see if you can get an extra a refill ahead. I think some doctors are filling ahead. I know sometimes the pharmacies are kind of funny, but have enough. Don't wait till the last minute. Don't run out. Make sure that you have what you need, because you don't want to be having to go to the hospital right now with all of this that's going on. Of course, the doctors are still working and we're still out there taking care of the patients, but you don't need any additional things that's happening. Likewise, if you have any mental health issues, or you have friends and family who have mental health issues, you want to make sure that you're checking on them. Being depressed and then having to be in the house by yourself can make depression worse. So then we have another situation on top of depression and corona. We have people who may be having really suicidal thoughts and struggling because of the isolation and because of the tendency to be isolated. So we want to make sure that in this time, because as we're thinking about the corona, we're not forgetting other people. You want to be checking on your elderly friends and family, your neighbors. Now's the time to see if they're doing okay. They weren't trying to stand in line for hours at the store and the hustle and the bustle of it all. And so sometimes for them, they kind of get forgotten, or they don't have the budget to buy and stockpile food for weeks at a time. So let's make sure that we're making sure they're okay as well, and that they have what they need. So again, taking care of you in this time is key, and that includes taking care of your mental health as well as your physical health. I know for myself, mentally, I can't really watch all of the stuff all the time on the feed, because at the end of the day, I don't have a choice to stay home. I don't have an option. I have to go out and I have to do what I have to do, and that's just what it is. So I can't read everybody's little, oh my God, we gotta do this, do this, do that, everybody's little feed, because it doesn't help me, and it stresses me out just a little bit more than I need to be stressed out if I have to deal with patients. So Facebook has this very lovely feature called unfollow, and it's not unfriend, and it's not I don't want to talk to you no more, I just can't read your feed right now. And in this kind of a season, we need to have that separation, that separation, that take a step back, that get your mind clear. Let's just focus, let's just do what we have to do, and not panic about all the constant bombardment and the multiple types of information that are coming in. Again, as I stated a little bit ago, most of the people have recovered. Most of the people who have been infected with corona worldwide have recovered. Some were sick for a while, but the overwhelming majority has recovered. Okay, so let's not think that this is kind of like a plague where you're going to get it. And if you're unfortunate enough to get it, that automatically it's a death sentence. Yes, Allison, unfollow. I have to unfollow some people. But I wanted to give you guys some tips tonight to just navigate the healthcare system at this point in time. Should you have to get involved and go, should you feel like you may have corona or may have contracted corona, I want to give you guys some tips, because I need you to maximize your interaction with the healthcare workers. I need everyone here, old, young, maximize what's going your personal experience and interaction to make it easier for you and make it easier for the people that are having to service you, should you end up having to go to the hospital, or should you get some symptoms that you think may be corona. So the first one, and this is really, like, it seems like it's not that important, but it is, and I need you to know your medical history. Know what's wrong with you. Even if it's from way back when, you need to know this. What's your medical history? And you need to write it down somewhere. You need to put it either on a piece of paper or on a phone, and have someone that you know and trust take care of that for you. Because in the event that something happens and you have to go into the emergency department, it will give them so much more assistance if you have everything they need sitting right there. People tend to forget, or they go, oh yeah, well, back, 10 years ago I had that stroke, or, oh, that time I had this such and such, or, well, I had this tumor. And you're like, whoa, what's going on? Because it's going to make a huge difference in how they would have to care for you if you have something wrong with you that you forget, or you just forgot about, or in the moment you can't remember because you're all over the place and you're scared and you're nervous. And listen, this is not the time to withhold information from somebody. You have to find somebody you trust. Some of you guys have secret diseases and secret things wrong with you that nobody knows. Now is not the time to not tell anyone those issues. If you're in the house with someone, you're quarantined with them, if you don't trust them enough to tell them, you got to write it on a piece of paper and seal it and say, listen, if I need to go to the hospital, give this to the people at the hospital, because they need to know all of the things that are wrong with me as opposed to not. For case in point, if you had HIV, you haven't told anyone, and there are lots of people out there who have HIV who don't tell anyone and who are carrying around the secret, you cannot get corona. That is not going to be well with you. So you have to make sure that if whoever's with you, if you feel sick, they have got to know off the bat what all your issues are so that they can help you out the best. Second thing, surgical history. Have you ever had surgery before? Did you have a car accident when you was 18 and they took part of your spleen out? That kind of stuff is going to matter. You would be surprised. I do this every day. And I'll have a question on my information that says, do you have any surgeries in the past? The patient will put, nope, no surgeries. And I'll go to do their exam and I'll see like a scar over here and a scar over there. And I'll say, well, what's this scar? Oh, I have a gallbladder taken out. Well, what's it? Oh, that was when I had a ruptured cyst and something, something, something. And I'm like, well, that's the surgery. They go, oh yeah, but it was a long time ago. It don't matter if it was 30 years ago or yesterday. The surgery is a surgery, and that needs to be, again, with your medical history, that needs to be written down somewhere so that anyone who is dealing with you as a new patient can know what they're dealing with if for some reason you would have to have another surgery. The other thing, and this is something that we all need to do, is know what medications we're on. I cannot tell you how many people tell me they're on a blood pressure pill. And I'm like, well, which one? And I say, oh, it's the little pink one. And I'm like, okay, does it have a name? Oh, it's the little blue one. I take that and I take a cholesterol pill. What's the name of it? Oh, I don't know. You got to know that stuff because you need to know what might interact with something else. You got to know what might not mix well with another medication. And that means that's as well for your moms, for your seniors. If you're taking care of seniors, aunties, uncles, moms, dads, you need to know what stuff they're on and how it interacts. Hey, Shayna, how it interacts with something else. You need to know, the people at the hospital need to know. And I know it's big names and it's big, words and stuff, but if you can't remember it, listen, we all have phones, right? Go to that picture and take pictures. Hey, Angela, take pictures of all the bottles. Take a picture of every pill bottle label and put it in an album on your phone, on your pictures that say, mom's meds or my meds or whatever. And that label is going to tell you what the medicine is, what the dose is, how frequently you're supposed to take it, who the doctor is that prescribed the medication, and that doctor's phone number. And so that's going to give that ER doctor or whomever a wealth of information. And that way you say, well, here's all her meds, they're all in this thing, and they can write it all down. And that gives them a lot of information that you don't even have to worry about remember. Take a picture of it exactly. While on the subject, your doctor. Who is your doctor? Where do you go? Who takes care of you? Have your doctor, if you have any kind of overwhelming health issues, I'm talking about kidney issues, diabetes, lupus, hey Colette, hey Natalia, lupus, rheumatoid arthritis, HIV, hepatitis, heart disease, heart issues. Keep your doctor's phone number in your contacts. Keep your doctor's number saved. And this Dr. So-and-so, bam, this is their phone number. This is how you get in touch with them. Call them. That should be a number that's in everybody's phone, especially if you have some type of underlying health issue or health problem that requires ongoing medical treatment. You definitely don't want to be out here talking about, oh, I don't know who my doctor is. I don't know how to get in touch with them. Most doctors have a service. Most doctors have a way to get in touch with them 24 hours a day. And you most definitely should have that information with you. That being said, if you feel like you need to go to the ED, call your doctor first. With this corona, the recommendations that are coming out of the CDC is to call your doctors first before you just proceed to the ER. Now, I don't know if all the doctor's offices have enough kits to do the testing, but they do want you to try to reach your doctor's office first if you have a regular doctor before just bombarding the emergency department, kind of as a screening measure so that they can assess you and make a decision on whether or not to send you all the way into the hospital or have you manage it at home. What you don't want is a bunch of people sitting in the ER who may or may not have corona giving it back and forth to each other. That's going to be a problem. The next thing you need to know is if you have any drug allergies. Now, just a word about drug allergies. An allergy is not an adverse reaction. So, like if I take penicillin or something and it makes me nauseous or it gives me diarrhea. That's an adverse reaction. That's not an actual allergy. A drug allergy involves your throat closing up, hives, itching, your eyes swelling up. That's an actual allergy. So try to know the difference between what you do and don't have. Because a lot of people, they'll come in and they'll say, oh, well, my mom said I can't take, penicillin. And I'll say, well, what happened? Well, when I was 2, I took it. And I'm like, okay, what happened? Well, I don't know. She just said I shouldn't take it anymore. And I'm like, okay, because when you put a particular drug allergy out, it can often limit what all they can give you because many drugs have cross reactivity. And so that can knock out a huge array of medications that could otherwise be used, but you said you have an allergy to one. And it actually may just be an adverse reaction. It may make your stomach upset. It may make you a little nauseous. That's not an allergy. That's just a bad reaction. And you can still take the medication and it can be effective because it won't kill you. You just may not feel so well. Okay? The other thing, the next thing is, if you have iPhones, again, you're going to write all these things down. You're going to store them someplace. You're going to be somewhere. The iPhones have a feature where you can put all that information on your iPhone. And should you fall out, they can get your phone and hit the emergency button. And the emergency button will pull up your information. Hey Tanya, the emergency button will pull up your information and it can have all that kind of stuff there. For instance, I have a drug allergy to medicine called ACE inhibitors. So I go into anaphylaxis if I take that. So if my blood pressure is high, you can't give me that medicine because it'll kill me. So that's in my iPhone, as well as my emergency contact information, who they should contact in case of something's going on, and any of the medications. I don't take any of the medicines, but if I did, there's a place for medications, there's a place for medical history. That's right. If you have an iPhone, hit that in your settings. You can put all your emergency information in there, and that can be available to anyone without them having to know your password or get into your phone. And it can let people know what's going on with you should you just for whatever reason happen to, hey, Savonia, happen to fall out somewhere in the street. So that's another way that technology is helping us to have that information. And then finally, guys, listen, we stressed, y'all stressed, but be gentle and kind, hey Yvonne, with your healthcare workers, right? They have been catching hell, not just for the virus, but because of all the precautions and the limitations. Most places are not letting you come in, or they're letting one person come in. And I'm L&D, and people get so excited that baby's coming. I know you've been waiting all these months to see this baby be born, but we're letting one person in the room, and that's usually the dad. And if that's not you, grandma, please don't cuss out the staff. Don't cuss out the nurses because you can't come in. We're trying to protect everybody involved. I know that your mom and pop are at the nursing home and you want to go see them and it's their birthday, but they're not letting you in. So just be mindful and try to just remember that we're protecting everyone involved with this by the restrictions that are currently in place. There's a lot of changes that typically wouldn't be there because of the coronavirus, because of the outbreak, and we want to make sure that everyone stays as safe as possible. And honestly, if someone's in the hospital, you probably don't even really want to go visit unless it's absolutely crucial because, as I said before, that nosocomial or that hospital-based strain of corona is more deadly than what's out in the public sector. So if you can avoid the hospital and avoid that hospital corona, you probably want to do that because that's been responsible for a lot of the deaths associated with the virus. So remember, guys, we're gonna get through this. It's gonna go past. We're gonna make it. We're gonna come out on the other side all right. The overwhelming majority of people have lived and are surviving this virus, should you be unfortunate enough to get it. We're going to remember, write down your history, put it someplace safe, be transparent with what you have going on, know your medications and that of your senior and elderly loved ones. know what allergies you do or don't have, and have all that information accessible so that if you have to interact with healthcare during this time, during this corona season, they will be well equipped to help you, and you'll have a less of a frustrating process. In the meantime, as they're saying, stay home, but check on your friends and family. Check on your people who live by themselves. Make sure that they're okay. Check on your friends and family who have depression, who are sad, who have baseline issues, and make sure that they're doing okay. And let's remember to be nice to each other. Don't fight over toilet paper and all that crazy stuff. And I will see you guys next week. You guys stay safe out there. Wash your hands. Wash your hands. Don't touch your face. No, I never touch my face because I just know where my hands are all the time. So I was like, I don't touch my face, like never, because, well, I know what I do for a living. But apparently a lot of people touch their face a lot. And because they touch their face a lot, they have to tell you guys don't touch your face. So don't touch your face. Wash your hands. I'll see you guys next week on Talk About It Tuesday. Thanks everybody for tuning in. You guys be safe. Take care. Bye.